everyone, this is Dr. Marcus here at Alvarado Healthcare. Just want to do another video of a discussion that I have with my patients commonly about carpal tunnel syndrome, okay? Many people have heard about carpal tunnel syndrome but not quite sure what it is. We're going to break that down here quickly. Carpal tunnel syndrome is whenever you have compression of the median nerve in the carpal tunnel. So here at the wrist is where the carpal tunnel is located, and that's exactly what it is. It's a tunnel within the carpal bones, or the small bones of my hand. And what happens is that when the nerve, specifically the median nerve, gets compressed, it can cause symptoms. And those symptoms, which you may be familiar with, could be numbness, tingling, or weakness in these three fingers here, okay? And 75% of people are going to be woken up at night because of this pain or discomfort. It can be in the left hand or the right hand, can be males, can be females, although there is a predisposition for females. What can increase the likelihood of having carpal tunnel syndrome? That can be increased with diabetics or people who are overweight, people with rheumatoid arthritis, or those who have hypothyroidism. In addition, some pregnant women will have fluid retention or increased fluid within the extremities, commonly the legs, but also they can have it in the arms, and they can get this as well. So what's important to know is that the American Academy of Neurology recommends that people try conservative treatment prior to having surgery. Surgery should be your last and final decision or choice to move forward with. So always try conservative treatment, whether that's a chiropractor or physical therapy, massage. You want to try these things out prior to having a surgical consultation. So what are some of the treatments that we do? What we have to do is figure out or pinpoint where exactly is that median nerve entrapped. So the median nerve exits through the neck, comes down the shoulder and the arm, and then into the hand. So while many people know of the carpal tunnel syndrome and this as a location of impingement, there are many other locations where that nerve can be impinged. And that can be in the forearm or the elbow, that can be in the shoulder or at the neck. So what we have to do is diagnose where specifically that nerve is entrapped. And then once we know where it's entrapped, we can then apply an effective treatment to help mobilize that nerve or release or that impingement. So that can be from muscle treatments or soft tissue manipulation, so loosening the muscles around the nerve so there's not as much compression. If it is fluid retention that's causing that compression, what we want to do is remove some of that excess fluid that's surrounding the nerve. Or in addition to that, we can manipulate or mobilize some of the joints. So research has shown that manipulating the carpal bones can be beneficial if it is carpal tunnel syndrome, as well if it's coming from the neck, mobilization of some of those joints can also relieve some pressure from that nerve. So just wanted to sum this up. A lot of people have experienced this or know somebody who has experienced this. We have a lot of good results treating patients with this condition once we know exactly where that impingement is occurring. And just bear in mind that actually it's less frequently found that the median nerve is entrapped at the carpal tunnel. More commonly, it's actually found in the neck or the elbow that there's impingement. So that's just something to keep in mind. A lot of patients sometimes they'll ask about braces, wearing them at night. While they do inhibit some of the symptoms or the pain or discomfort of carpal tunnel syndrome, it's not really a good effective long-term fix for that problem. If you would like a long-term fix and would like to get this taken care of, please reach out to us or let us know if there's anything we can do to help answer any questions for you. Thank you very much for your time and have a great day.